Good evening. You're all so welcome as you join us for this evening's webinar with myself. My own name is Paula, and our principal psychologist here at Constellation Healthcare, Dr. Eoin Rickard. It's our pleasure to have you with us. This evening, we have a hopefully really informative and practical session ahead for you. Our aim is to give you ideas of what to think about and tune into to help you understand what you may be observing in your child. So just before we get underway, I want to explain a little bit about who Constellation Healthcare are. For those of you who aren't familiar with us, we're a highly experienced specialist provider of neurodevelopmental assessments and intervention for children and adolescents throughout Ireland. As well as being an appointed provider of assessment of need on behalf of the HSE for a number of years, we also provide a private autism assessment service so that families may book us directly. Through our work, we support thousands of families annually with our expert multidisciplinary team. We pride ourselves on providing a really child-centered approach to our autism assessments, which are grounded in best practice clinical standards. Our reports are clear, comprehensive, and recognised and accepted by the HSE and school systems nationwide, providing families with clarity and the confidence they need to move forward with supporting their children. What we're going to cover tonight is really based on being very practical. Dr. Rickard is going to talk you through some of the signs you may be observing and explore how developmental differences associated with autism can also be seen alongside other profiles such as ADHD, intellectual disability, or experiences like social anxiety. We've a lot to get through in the next 45, 50 minutes or so, and we're going to get started in just a minute. I would encourage you to drop any questions you have into the chat. We do hope to get to answer them towards the end of the session, but if not, let me assure you, Dr. Rickard is going to take time over the next couple of days to formulate responses to each of your specific questions, and I'll share them back out with you. If you prefer to email me directly with your questions, I'll drop my email into the chat in a second. Now, it's my pleasure to introduce our speaker, Dr. Eoin Rickard. Eoin is a highly experienced clinical psychologist and our principal psychologist here at Constellation Healthcare. We're delighted to have his time with us this evening, and without further ado, over to you, Eoin.
Thanks very much, Paula, and thanks for that kind introduction. And you're all very welcome along this evening. It's something where you may have joined for a previous webinar. And again, this slide will look familiar, so where I'll start with. So I'll talk a little bit, just very, very briefly about what is autism, just to kind of give a bit of context. So again, it is most simply understood as a neurodevelopmental condition. And what that means is differences in brain development for a person. So it relates to, again, a couple of different areas. So mainly social communication, and by that I mean things like gestures, facial expression, tone of voice, kind of language use, that side of things. Social interaction, which is things like kind of social cues, social rules, that side of things, and eye contact can also come into play there as well. And then what we call restricted and repetitive behaviors, and that includes a lot of different kind of aspects. So things like the person's sensory profile, sensory interests they might have, or sensory aversions that they might have. It also would include things like play, the person's interests. It includes things like maybe kind of behaviors that are soothing behaviors, or maybe kind of motor behaviors as well that would be kind of soothing behaviors. So maybe kind of, you might be familiar with the expression kind of stimming. So those kind of things would come under that aspect. It's something that I'll talk a bit about, and you'll get a good sense of that. Again, there is a huge amount of variation within autism. There's also a huge amount of variation within child development generally, and that will become very apparent as we're talking. If you're not already aware, you'll be very well aware by the end of the presentation. So it's something where, again, we'll try to talk to you a little bit about what kind of things you might notice. And again, the aim will be very practical in terms of being able to kind of tune into different areas and tune into different behaviors and what you're seeing. So, as I say, neurodevelopment is not straightforward, and different kinds of characteristics, different kind of behaviors can overlap. Things can look very similar on the surface, and sometimes, again, a behavior might look very similar for two different children, and the reasons for it can be very, very different. Behaviors can also emerge over time and then disappear over time or become less prominent over time, and it's something that that can be a little bit tricky to kind of understand at times. So Today, I'm going to focus a little bit more on differentiating more so than co-occurrence. So again, a lot of the things that we talk about can all co-occur with autism, and again, some aspects across them can appear similar. And again, there's a wide degree of different kind of presentations and profiles. So it's something where I'll focus a little bit more on differentiating them because again, the degree of complexity that we'll be going into with talking about co-occurrence would take again probably another presentation to talk about. So again, in terms of what kind of things can appear similar, can overlap. In terms of neurodevelopment, we're talking about things like intellectual disability, ADHD, also things like developmental coordination disorder, which would have been previously known as dyspraxia, and things like dyslexia. So again, in relation to neurodevelopment. And on the mental health side of things, again, we'll talk a bit about anxiety, but also can overlap with things like depression. So I think it's something that it's again, it'll become very apparent about the level of complexity and why it can be tricky to kind of tease things out and why it's helpful to have to go through the assessment process to try and tease things out. It's something where when we're doing an assessment, we will do that using kind of generally observation of behavior and around developmental history over time. So we're really trying to get a good picture of the person over time and around their behavior. And we don't really use biological testing, and there is no biological test in relation to autism or in relation to ADHD. With some elements relating to intellectual disability, there can be, so in relation to maybe genetic or chromosomal differences, but equally, there can be situations where it's not possible to do biological tests for intellectual disabilities. So we tend to try and use behavior, developmental history to understand things. And because similar behaviors can occur for different reasons, we need to really kind of put a lot of thought into it. And it could be very, very challenging, especially when you're in the middle of a situation as a parent and you're seeing different things and different things emerging, to try and step back and kind of really, really take account of the context of everything. So that's where assessment can be very useful. The first area I'm going to talk about is anxiety. And again, anxiety is quite common in young people, both typical kind of we all experience anxiety. We probably all as children would have experienced anxiety. Um, and up to the level of mental health needs. So again, when we're talking about that kind of clinical level of anxiety and different kind of areas that we'd look at would be social anxiety, generalized anxiety, phobias or specific phobias, OCD, and also PTSD, which would be kind of understood under the wider umbrella of anxiety. And it's something where there are many different forms and causes of anxiety or bases to it, but the most relevant to autism is social anxiety. There's also a little bit of overlap with OCD, and I did consider kind of talking a little bit in more depth about OCD and the overlap with autism. But again, it's not as common and can take a bit of time, a bit of extra time to go into detail with it. So I felt the more applicable one would be social anxiety to focus on. And just as a definition, and to be kind of clear about what it means, it is the fear of negative evaluation by others. So that's the kind of simplest way of describing what social anxiety is. And it's also something that's helpful to talk about in relation to anxiety is that a behavior which a person who is feeling anxious, this is not just in relation to social anxiety, but for our purposes, kind of it'll relate to it. But any behavior which a person uses to reduce or avoid anxiety is what we call a safety behavior. So you may be familiar with that term, but if not, that's kind of what we describe if someone is doing something to try and avoid experiencing anxiety or to try and reduce their anxiety, it would be called a safety behavior. So that's just a bit of background. The areas where autism and anxiety can overlap and social anxiety kind of you're looking at reduced engagement with others and maybe avoidance of social settings in the area of social communication and the impact on how the person interacts in maybe kind of one-to-one and in groups. There can be an impact on relationship building or friendship building over time, and also maintenance and sustaining friendships and relationships over time. And then there's also the physical response. So sometimes, again, a person who's feeling anxious may kind of fidget with things, or maybe a little bit kind of agitated, what we call psychomotor agitation, maybe kind of moving a bit more. And that can kind of sometimes it could be tricky to distinguish between that and where a person who's autistic is stimming. So with autism, though, you'd also expect to see other characteristics. So things like, again, as I mentioned, sensory aversions or interests or adherence to routines and maybe kind of strong or maybe potentially interests that are a little bit out of the ordinary. And also around language characteristics that are, and again, we'll talk in a little bit more detail about the times when you might see some overlap in language characteristics between anxiety and autism, but you would expect to see them a little bit more across contexts with autism. So, I've kind of laid out a couple of different areas where to focus on where there's a bit of overlap. And again, looking through kind of childhood and the first one is around a child maybe not engaging with others. And with autism, again, a child may not engage with others because they're not as interested in engaging. They may prefer to play by themselves. They may kind of ignore others if someone comes over to try and interact with them, or they may not be maybe kind of tuning into others. Let's say if they're out and about at the park or in the playground, they may be happy enough doing their own thing and not necessarily kind of watching other people or trying to go over and interact, maybe kind of keeping to themselves. Where the child might be socially anxious, that might be the case where the child is interested in engaging with others, but might be wary about the consequences of interaction. So, something that's really that will kind of be kind of core to all the different aspects of the overlap between autism and anxiety is around the kind of the basis of anxiety tends to be more so in relation to kind of cognitive factors. So maybe what the person is thinking about the situation and what the person's kind of what kind of flows from that kind of thinking about the situation. So maybe a child is kind of thinking that other kid might be a little bit rough if they look a little bit rough in their play or a little bit more kind of boisterous. So I don't really want to go over because maybe I might get hurt, or they might feel maybe I might get teased if I go over to the group, or they're kind of thinking through maybe what might not go so well with the interaction. Whereas with autism for younger kids, it is that they would prefer just to do their own thing. And again, similarly, when someone else comes up to engage with them, they may kind of ignore the other person and may not respond at all. Whereas an anxious child might hide behind their parent or their caregiver. They may be kind of watching to see what the person is doing. So they might be a little bit more vigilant and tuning into the other person, but just kind of keeping back and trying to put a bit of distance between themselves. And that's something which you might see. So some helpful questions to have a think about. If you're not sure, maybe again, there can be a little bit of nuance with it. So just keeping an eye on kind of, is your child kind of watching other kids, even if they're not going over or if they don't respond when someone comes over to them? Are they kind of watching other kids? Are they tuning into what's going on with other kids kind of playing around them? And is that often or is that rarely? Because again, autistic kids might be interested in other kids at times, but maybe the majority of the time they're more interested in their own kind of play or doing their own thing. Whereas socially anxious child might be kind of actually quite kind of tuned in and kind of watching to see what other kids are doing. Again, maybe kind of thinking about just keeping an eye on what's happening, and maybe again demonstrating that interest and wanting to go over and interact, but being a little bit wary of it. And also, and this will come up a number of times for a number of different areas, so it's a really important point around how the child is across different contexts. So are they a little bit more sociable with familiar kids and family? Are they more wary kind of new kids, maybe kids they're not that familiar with, or adults that they're not that familiar with? Or are they similarly kind of happier to be by themselves no matter what the situation? So whether they're at home with people that they know well, or whether they're in the community or in school or preschool with kids that they don't know as well. So that's a really helpful kind of thing to tune into. And again, I'll come back to a few different kind of areas that does come up in relation to a lot of different aspects when you're trying to tease it apart. So the next piece, and this is kind of looking at sometimes older kids or adolescents as well. So in relation to not just kind of engagement with others or interest in others and motivation, but also around kind of social situations and thinking here in terms of groups. So I said for over the age of 3 because that it's kind of group situations or group play or group involvement tends to increase in frequency kind of as kids get older. Their opportunities to do it go up, and the likelihood of it happening goes up as well. Whereas when they're very young, there's less opportunity around that kind of engagement. So for autistic kids, again, you might see that kind of lack of interest in group play, but also you might see the amount of effort, and that we'll come back to that a couple of times this evening as well, about the amount of effort needed to kind of to engage or to kind of sustain or stay as part of a kind of group. So again, it's something that we know that kind of social demands tend to increase as kids get older. So as kids kind of progress through childhood and into adolescence, the social demands around them tend to increase. And so, for an autistic child, where the social communication or social interaction aspects of engagement may be a little bit trickier for them, that demand or the amount of effort that they need to kind of put in to try and engage with their peers goes up as well. So that could be quite exhausting and quite tiring and can take a lot of effort. And that may lead a child who's autistic to kind of say maybe I'm not feeling like doing that today. I may prefer just to kind of stick to myself or stick to kind of smaller groups or one-to-one play. Now, you can see that as well with social anxiety at times where kids may avoid groups or may prefer to kind of stick to one-to-one play, or they may kind of get on a bit better in one-to-one play. But again, that comes back to potentially their kind of thinking about the situation. So again, that idea of maybe what if I do something wrong in the group? What if I say the wrong thing? What if I say something and people think that it was silly, or that people don't like me in the group? Or what if I'm not able to manage in the situation? So it's coming back to the person's thinking about the situation. And again, one of the points that you might kind of see is that oftentimes with a socially anxious person, they actually have pretty good awareness of social rules and social cues. So they are tuning into things, but they may actually underestimate their own awareness, or they may underestimate their own ability to manage in a group. If they're asked to kind of rate how they will get on in a group situation or in a social situation, they may actually underestimate their ability to do it. Whereas, again, it might be the case for an autistic child that they do find that those kind of unwritten kind of social rules and social cues tricky to spot or to understand. And again, I've given a few examples there of what those can be. And again, as I said, there's a lot of variation within autism, and so again, there may be kids who'd be very socially motivated, but they might be a little bit self-conscious around that they have a bit of challenge with recognizing kind of social cues or social rules, and so that can lead them to maybe kind of avoid group situation. So it's something where again, in terms of you're trying to tease it out or trying to understand it a little bit, some questions that can help with that are, again, was it the case that when your child was a bit younger, did they show a bit more interest and engagement? And over time, maybe they've started to pull back a little bit. That can relate to both autism and anxiety, because as I say, social demands go up as kids get older. But again, trying to tune into what exactly is it that what are the reasons that the child kind of names, and is the child able to name what it is about the situation that is where they want to pull back? Because again, an autistic child may be kind of saying, I'm actually kind of happy enough to do my own thing. I'm not particularly bothered about kind of groups. I'm happy enough. Whereas a socially anxious child may have a stronger motivation to be in kind of group situations. So maybe kind of at a club, or at again playing with kind of group of friends on the road. But it might be the case that they are feeling maybe that they're not able to do it, or that it's too anxiety provoking for them. So thinking about the kind of context, and on that, in terms of context, it's also thinking about if this is a behavior that's emerged over time, because again, sometimes it can be the case that for an autistic child, as the social demands go up, they may be getting on okay in groups kind of at the kind of preschool or school age, but as things go on, they tend to start developing more of a preference to do one-to-one play, because they prefer the kind of predictability of it, or they may prefer the kind of just it's a little bit more understandable or predictable. And it's something where having to think about if there has been anything else going on in the child's life, that can give a good sense of the kind of context. So with social anxiety, again, that can be impacted by things like maybe an incident of kind of social embarrassment, maybe a kind of significant um, uh, social embarrassment that they would have had at school or at home. It can be the case where bullying can sometimes impact on the child's confidence in terms of social interaction. Bereavement can also impact. And so those things might be more so linked to anxiety. So that's if you're seeing something emerging over time. The next area to look at is eye contact. And I'm sure you'd be kind of familiar with this in relation to autism, and something where it can also kind of come into play with social anxiety. And it's helpful to kind of think about it. Oftentimes, people think about eye contact when they're thinking about autism, that it means just not using eye contact, or not making eye contact. But it's actually more helpful to think of it as, when does the child use eye contact and why? Because sometimes with autism, it's the case where a child may not see the purpose of it. So this can kind of get a little bit at perspective taking, and kind of recognizing the other person may kind of get a degree of kind of social understanding from the person using eye contact. So if I'm using eye contact, it can assist a little bit with communication. And sometimes for autistic people, they may not see that kind of element of it, so that the other person may get a bit of extra understanding from my use of eye contact. It also can be the case for an autistic person that they might find combining eye contact with other forms of communication to be difficult. So this would be things like, if you think about it, when we're conversing or when we're talking, we're oftentimes using speech, we're oftentimes using eye contact, we're using facial expression, we're using our posture, our proximity from the other person, we're using gestures, and we're putting all those things together. That's quite complex. There's a lot going on there with that interaction. And so that can be a little bit more tricky for an autistic person. So they may find that they can use eye contact at certain times when they're not using those other forms of communication. And when they are kind of using more combined, it can be tricky to use eye contact. So you're looking at when the child is using eye contact, not just are they using eye contact, yes or no. Because again, with social anxiety, oftentimes kids may avoid using eye contact or will prefer not to use eye contact because they might feel a bit overwhelmed by the intensity of using it and the what's the word, the intensity of it. That can sometimes be the case with autism as well. But again, with social anxiety, there's often the underlying rationale for it is that the person wants to reduce the likelihood of someone else interacting with them. So this is something where if you might be familiar with thinking of like if you're in a group situation or at school, let's say, and a teacher is kind of calling out the kids in the class to maybe answer a question. And what do most of the kids in the class do? They look away, they'll look down at their desk, they might look out the window, they'll try to avoid eye contact with the teacher because it means it's less likely that an interaction is going to start. So if you think about it, oftentimes we use eye contact to start or to try and avoid starting an interaction. And so that is where that difference may come into play. So if a child is socially anxious, they may be using eye contact less. And so you may be thinking, they're not really using eye contact that much. But what is the rationale for that? Is it that they're trying to reduce interaction? Because it's a way of, in a way, it's actually showing an awareness of the other person's perspective because they're aware if I'm not looking at the person, they're less likely to talk to me or less likely to maybe start an interaction with me. So again, if you're tuning into questions that could be helpful, you're thinking when and how does your child use eye contact? Not just do they use it, yes or no, but how do they use it? And do they combine it with other types of communication? Does your child use eye contact more with familiar people, or is it the same no matter who? Because again, autistic people are more likely to use eye contact in a similar way across contexts. So whether it's a person who's familiar to them or not, whereas someone who's socially anxious may be more likely to reduce their use of eye contact if they're talking to someone that they're not so familiar with. And also about has eye contact use changed over time? So again, kind of touching on the last slide as well, where social demands go up over time. Again, it may be the case where if someone is becoming socially anxious over time, and that is emerging over time, that's a little bit less likely to happen with autism. So eye contact use may be a little bit more stable over time, and how the person engages is a bit more stable with autism. And with social anxiety, you may see it kind of emerging, but you also may see it going away as social anxiety decreases over time as well if the person is getting support. So the last area I'll talk about in relation to anxiety is just around communication. And again, looking at autism, first of all. So again, sometimes it could be the case where the child might find it hard to know what's expected of them in a conversation. So this might be that idea of in a back and forth conversation, the child may find it tricky to know how to respond to kind of what we say kind of conversational leads. So if someone kind of says, oh, I was away on, I was just back there from holidays there last week, and you may kind of respond typically kind of in saying kind of, oh, what was it like? What was the hotel like? Or did you go anywhere nice? Did you go to a nice restaurant? Or something like that, and kind of giving something back to kind of keep the conversation going. An autistic person might find it tricky to know exactly what is expected of them in that back and forth. So what to say next and where to go with it to keep the conversation going. Now, again, this varies across different people, but it does tend to be a little bit more common for autistic people. So that's something where they might freeze up in the conversation, maybe because they're not sure about where to go next with it, or they might not know what's expected of them in the response. Whereas with social anxiety, a child may freeze up in a conversation and not know where to go next with it because they might be a bit afraid of making an error or saying the wrong thing. And so it also becomes the case with social anxiety where the kind of physical and the cognitive aspects of it can make it a little bit trickier to think of what to say, how to answer. So again, maybe kind of dry throat or racing thoughts or the person's mind going blank. And those are all things where maybe after the fact the person says, oh, I could have said this or I could have said that. But in the moment, the actual physical characteristics of anxiety can make it tricky to access some of the the person's kind of social repertoire, if you know what I mean. So again, you're looking at the reasons why it might look the same, and again, it might on the surface it might look like the person is just not answering or might be finding it hard to do the back and forth of a conversation. But again, the reasons for it being a little bit different, and again, looking at the kind of physical and cognitive characteristics. So, the other thing that can be a little bit of an overlap is where some autistic children, naturally, as part of their communication style, may speak quietly or they may speak quickly. And the important thing there is that it's regardless of emotional state. So, sometimes when we're anxious, we might be speaking a lot quicker because we want to get the interaction over with, or we might be speaking a little bit quieter, which might be, again, that bit of shyness, that bit of wariness about what the other person might or how the other person might respond to what we said. And again, sometimes that could be counterintuitive with social anxiety because the person may end up having to repeat themselves because the other person didn't hear it. But the thing is, again, around the is that something that only happens in certain contexts? Does it only happen when the person is a bit under pressure? And as I say, maybe when they're feeling stressed or where it's with new people, or is it always? And is it the case that maybe it's in groups, but on a one-to-one, the person might be a bit different in how they communicate? So also the thing is around, and again, it's probably the more obvious kind of thing to look for is your child kind of visibly anxious when they're communicating, or are they calm? Because again, if an autistic child is not quite sure where to go next with the conversation, they may be kind of they may be a little bit more relaxed than that and kind of saying, that they're not quite sure where to go with it. Whereas a child who's socially anxious may be a little bit visibly worried. So again, seeing those kind of physical kind of characteristics of anxiety. And also, again, as I touched on before, and will come up a few more times as well, around is that something that happens just in the like, does it happen in the home context as well as with others? So, do you see that kind of is that kind of a characteristic of the child, no matter who they're with or who they're talking to or where they're communicating, or is it only in certain contexts? If it's only in certain contexts, it may be more so kind of social anxiety more so than in relation to autism. So that kind of gives you a bit of an overview. And again, there's a lot more depth we could go into in relation to social anxiety and anxiety more generally. But that's just to give a kind of brief overview of the things that are most kind of common in terms of overlap. So turning to look at ADHD next. And again, as a bit of background, so ADHD is another neurodevelopmental condition, and this time characterized by inattention, hyperactivity, and impulsivity. And there are different types of ADHD, and one type is predominantly inattentive. There is a combined type, and then there's also hyperactive impulsive predominant, although that one is quite rare. That one does tend to come up much more rarely. So you tend to more often see either inattentive type or combined type. And again, it's something where it can co-occur with autism, and it tends to co-occur more so with DCD dyspraxia, but it can co-occur with autism, and again can also look certain characteristics can look similar to some of the characteristics that come up in relation to autism. So ADHD is something that tends to emerge a little bit later, and I'm sure some of you listening are kind of thinking of potentially maybe younger kids, or maybe are aware of younger kids where they might have been kind of characteristics relating to ADHD that were coming through under the age of 7. And that certainly is the case. But usually from a clinician's point of view, we tend to be more confident around identifying ADHD over the age of 7, kind of in relation to the demands that tend to come kind of as kids get older. So again, once kids are around the age of 7, they tend to be well settled into primary school, and they tend to be more of an expectation that they're able to kind of sit and attend and do work for longer kind of periods of time. So that's when some of the challenges that can relate to ADHD become really apparent. And it's something that at the same time, the diagnostic criteria that we look at in relation to ADHD, there should be some characteristics or some evidence before the child was the age of 12. So that kind of time period is particularly important in terms of identifying it. It's also just a note around ADHD, which is a term that people will use, and that can be very helpful in terms of a person kind of describing their own experiences. And it's something where a person has maybe a diagnosis of autism and ADHD, it's something just to say that things tend to vary so much from person to person, and the different people's experiences of autism and ADHD vary so much that we wouldn't really, as clinicians, think of ADHD as meaning kind of a specific type of presentation. So you wouldn't necessarily say that things are more likely to be apparent for a person who has ADHD or has autism and ADHD combined. It is more so maybe I think a helpful way for people to describe themselves, or maybe an easier way to describe themselves than saying I'm autistic and I have ADHD. So it's something that it varies so much that again, it's something where you really are trying to think of the individual kind of experience for the person rather than a specific kind of type of presentation. So that's just to give a bit of background in relation to that co-occurrence. So it's important to say that the actual primary characteristics of ADHD and autism don't really overlap. So again, social communication, social interaction, and restricted repetitive behaviors for autism, and inattentiveness, hyperactivity, and impulsivity for ADHD. The areas where they overlap tends to be the kind of impact of those primary characteristics. So how those characteristics are manifest or the kind of behaviors that come alongside them, that's where we tend to see a lot of overlap. So both for autism and ADHD, you can see distractibility for kids, sensory processing, and their sensory profile, and having maybe needs in relation to those or differences in relation to those, but for different reasons. Again, different underlying reasons. The social impact for both can look similar. So again, there may be kind of challenges with making friends or sustaining friendships over time, or relationships. But again, the reasons for that could be different, and we'll talk about that in some detail. And the academic impact, again, there may be kind of the sensory impact of the environment. It could be distracting for an autistic child rather than for a child who's ADHD, where there's that inherent inattention regardless even of the sensory environment. So maybe amplified by the sensory environment, but there's that inherent inattention there for ADHD regardless. And again, that kind of seeing kind of kids maybe wanting to get up and move around and get up and kind of seek out kind of movement, but again, different reasons. And again, you would tend to see different types of movement for both. And also, again, you can see kind of challenges with sleep can be common for both. So looking at a couple of specific areas. So one that is probably one that people would be familiar with or thinking of if you're kind of if you're wondering kind of for your own child, it might be thinking in terms of their emotional and behavioral regulation or distress. And so with autism, it can tend to be the case that a child might become distressed in relation to changes in routine or unpredictability, something happening that they weren't expecting, something kind of in relation to sensory overload. So again, the sensory environment, and also around challenges with social interactions across settings. So those are things that you can see maybe kind of distress can cause distress for a child who's autistic. In relation to ADHD, it may be again a kind of wider range of things. So again, oftentimes with ADHD, you're thinking in terms of impulsivity and sometimes things happening kind of, or the person responding very, very quickly to what's going on internally. So having maybe a lower level of frustration tolerance. So that might be a little bit less specific. So there may be less specific kind of things or situations that will prompt it. Again, it can be specific as well, but potentially a little bit less so than with autism. And it can be the case where maybe just that broader kind of frustration tolerance can be a little bit more challenging. Something I think it's important to kind of talk about, because oftentimes this is something that parents during an assessment will kind of note or pick up on around school and around a child maybe seeming to get on fine in school or appearing to get on fine in school, and then feeling really distressed after school or really exhausted after school. And you can see that with both autism and ADHD, and this crosses over with the kind of concept of masking. So this is for both, maybe where the person is having to exert a lot of effort during the day. So trying to kind of navigate through the social demands with autism, social demands, sensory demands, that unpredictability that can come. And with ADHD, maybe around the attentional demands, maybe trying to inhibit movement. Again, social demands, which we'll talk a little bit about in relation to ADHD in a moment, and also the sensory demands as well. So we tend to kind of talk about masking, and what that means is basically that the person is kind of has a bit of an idea about what's expected of them during the school day, or maybe kind of has kind of learned over time that certain behaviors are expected or certain behaviors are a bit more visible, and so the person may try to downplay them or inhibit them during the day, and those behaviors will vary a bit for autism and ADHD, but the kind of the similarity between the two is where the person is having to exert a lot of effort, a lot of mental effort goes into it. So during the day, they're having to spend a lot of kind of time consciously trying to inhibit their behavior or adjust their behavior and adapt it. So what parents can see is their child kind of coming home from school and being very dysregulated or very exhausted. And some again, it can be something to pick up on in relation to autism would be that potentially the duration of that kind of distress or exhaustion might last for a longer time than you would see with ADHD. So it might be a little bit more brief, but potentially it might be a little more frequent. It depends. Again, very much on the person, but it can be a little bit more in terms of the duration and the intensity of it can be a little bit stronger with autism. Um, Also, it could be the case where maybe an autistic child might find it a little bit trickier after the event to describe what they were feeling. So that can often be a kind of characteristic with autism where a person maybe struggles to describe exactly what emotion it was they were feeling or describe what it felt like in their body. Whereas a child with ADHD may be a little bit better able to put the label on it and say, I was actually feeling really, really stressed out there. I was feeling really angry or I was feeling really frustrated. But in the moment, it's very, very tricky to contain it. So maybe able to reflect on it afterwards, but may find it keeps on happening, even though they're able to identify it. And that can actually lead to additional frustration because the person is very kind of conscious about it and could be conscious about what kind of things are stressors for them, but it's difficult in the moment to contain it. So again, some helpful questions to gauge that and kind of tease that out are again looking at the kinds of situations or environments that can lead to distress for a child, the intensity and the duration for the behavior. And when I say the behavior, again, it's whether the child's distressed or the child's dysregulated or exhausted after the situation. And again, also looking at their insight and their awareness around it. How are they able to kind of describe it? Did they find it tricky to describe it? Did they find it tricky to describe what the feeling in the body feels like, or put a name or a label on the emotion after the situation or after the fact? So, the next area that we look at is in relation to social communication. And again, some of the aspects for autism we've touched on a little bit in relation to anxiety already. So again, around sustained conversation maybe being challenging in relation to awareness or interest or the effort of it, and around that kind of understanding of unwritten social cues and social rules. And again, where that would differ between autism and ADHD is where a child with ADHD would oftentimes have a good understanding of the social rules or social cues expected, but that impulsivity and that kind of inattention can impact on their ability to engage in conversation or to engage in social interaction or communication with others. So potentially where a child might interrupt in a conversation or they may find their mind wandering when they're conversing, they may miss details in a conversation. And again, something which we'd find is that, particularly in a group situation, because the dynamic and the level of social demand compared to being in a one-to-one situation versus being in a group, there's a lot more different things to follow, a lot more threads to kind of pick up on, a lot more to try and focus on. So again, that effort of trying to stay in a conversation or trying to stay in a group setting might be a little bit trickier. And so again, the effort of engagement for a child with ADHD might be very high, and also the effort of engagement for a child who's autistic might be very high. But again, the reasoning for that might be a little bit different. So on the surface, you're seeing that they may be struggling a little bit with that social communication and social interaction, but the reasons for that are different. And again, it's something that can come up, and parents might kind of say that their child is a little bit impulsive and with kind of saying what's on their mind. And with autism, that can sometimes maybe be perceived a little bit as kind of bluntness, where the person is kind of saying it as they see it, and kind of saying maybe kind of observing something and calling it out, and maybe where another person may not kind of point out something or point out a situation or point out a fact of the situation, and maybe afterwards kind of saying to the child, I don't think the other person kind of took that very well, or they may not have liked what you said. And oftentimes what you find with autism is the child might kind of say, well, like, I'm telling the truth, like there's nothing incorrect about what I said, and I don't see why it's not okay to kind of say that, and being truthful and being honest here. Whereas with ADHD, um, so again, that with autism, that can appear impulsive, but in actual fact, the child is kind of well aware of kind of what they're saying and is thinking about it and is kind of saying it, having put a bit of thought into it. With ADHD, it may be the case that the comment has come to mind, and the child may have said it without kind of having the opportunity to kind of think about it. And again, that can sometimes be a little bit more relating to that inherent impulsivity. And so the child with ADHD may afterwards kind of be a little bit more kind of going, oh God, I wish I hadn't said that, or I didn't mean to say that. That just kind of came out. And so that is a little bit of an area difference. And again, that can lead to a little bit of frustration on the part of the child. So feeling frustrated at themselves because they're aware kind of where they might have not meant to say something, but they find it hard to contain themselves or inhibit themselves in the moment, which is just inherently kind of relating to ADHD. The other kind of aspect in relation to social communication is around eye contact. And again, already described in relation to autism. And with ADHD, sometimes kids might use eye contact a little bit differently or use it a little bit less. It might be a little bit more fleeting because they might be a bit more distractible. So they might be looking around and picking up on what's going on in the environment around them. And so a little bit more fleeting with their eye contact. And also, it might be the case their mind wanders a little bit when they're in conversation. And so their eye contact might be a little bit more fleeting because of that. So again, like as I said earlier, you're thinking about how exactly does eye contact look? What exactly does that? Uh, how exactly does the child use it, and when does that change, depending on the situation, and again over time. So a couple of things to tune into there around the context of the child's communication and across settings, the child's awareness of feedback and their response to kind of feedback. So are they kind of, how do they reflect on a situation afterwards? And also around that frustration with difficulty of an inhibition, that comes a little bit more so with ADHD than it does with autism. The next aspect is in relation to, so again, social interaction and maintaining relationships. And again, that can kind of tie in a little bit to the previous slide. So with social communication, talking about the kind of effort of engagement, which again, sometimes kids who have ADHD can find that that kind of group engagement over time and trying to keep on top of things can be tiring. So they may have to kind of withdraw themselves from a group situation because they're feeling a bit exhausted or a bit burnt out from the interaction. Again, by comparison to a child who's autistic who may prefer to play by themselves and may tend to avoid groups because they prefer that kind of one-to-one play or to do things on their own. It can also be the case again where with both ADHD and autism that some of the characteristics associated can be a little bit harder for especially younger kids to kind of understand or to keep their patience with. So again, with autism, that might be the person kind of talking about their interests in detail or maybe kind of not following the kind of social cues of the conversation or kind of conversing in a bit of a different way and around sometimes as well in relation to kind of rule adherence in play. So sometimes kids can be can autistic kids might want to do a game or to do play in a very particular way, which other kids can be a little bit, they can find that a bit hard to understand or they can push back against, and that can sometimes cause a bit of conflict. And again, sometimes with ADHD, by comparison, again, some of the social communication aspects that we talked about. So again, things like maybe interrupting in a conversation or losing focus, or kind of forgetting plans, making plans and forgetting that they've made them, or lateness or that kind of side of things, and deviating from rules because that kind of seeking out novelty is again a characteristic with ADHD. So that can sometimes lead to conflict between children, and that can impact on interaction and maintenance and friendship over time. So it's also the case that for autistic kids, that kind of predictability and sameness in interaction is something that might be sought after, or might be something they'd seek out. Whereas for children with ADHD, they might be actually seeking out novelty and change. So they may kind of have kind of shorter kind of relationships because or shorter friendships because they're kind of looking for something a bit different, and they may be kind of looking for that kind of novelty and change. So that can impact a little bit. And again, in terms of your questions and trying to tease the two out, having a bit of a think about the maybe nature of kind of friendship over time, and again, has that become a little bit more challenging over time? Has the nature of it changed a little bit? And again, looking at that kind of motivation. So again, it may be the case that a child with ADHD is expressing a bit more motivation around kind of playing in groups or kind of doing group activities or that kind of play. And maybe again, it's the case that maybe a little bit less for kids who are autistic. So another aspect is in relation to movement seeking and energy. And again, this is something where you can see, as I mentioned at the outset, it is the case that for both autism and ADHD, kids may be kind of seeking out movement or seeking out kind of stimulation, but in different ways. So with autism, you may see kind of a bit more repeated or more kind of maybe the same kind of stimulation behaviors repeatedly day on day. So maybe kind of hand movements, maybe it may be kind of pacing, or maybe kind of spinning or jumping, things again, that can be a little bit more complex and things that you might see, again, repeatedly over time, but also, and a really important kind of facet is that they are kind of soothing behavior. So there's that kind of soothing kind of quality to it. So that's an element that isn't as prevalent with ADHD, or it's not as characteristic of ADHD, but that idea that the movement is actually kind of soothing for the person, that's a little bit more so characteristic of autism. With ADHD, you might see a child fidgeting, you might see that kind of restlessness, you might see that kind of difficulty sitting. And usually those kind of movements with ADHD are a bit less complex in nature, or they're a little bit more novel. So a child might get up because they kind of think, oh, I really want to talk to someone over here, or just need to get up and move. I want to get up and climb, or want to kind of maybe kind of see jumping off furniture. But it may be the case that with an autistic child, they may be a little bit more likely to do the same kind of movement. So maybe kind of getting up from their desk and kind of walking across to the maybe a part of the room in the classroom to kind of to go to a particular point in the classroom and then back to their desk, and then maybe getting up and going back to that part of the classroom again and back to their desk. So it might be the kind of again this the sameness of that kind of movement as well as the need to move. So another aspect that can discriminate between the two is whether it is asking the person to stop, or asking the child to stop doing the behavior is distressing for them. So sometimes it can be the case where autistic kids can be because of that kind of soothing element, that asking them to stop while they're doing it can be quite distressing. They want to kind of finish it out, and stopping can be quite overwhelming. And so they need to maybe finish it out, and it's helping them to regulate themselves. There is that kind of regulation aspect with ADHD, but oftentimes kids will kind of be a little bit more likely to kind of say, yeah, okay, if they're getting up out of their chair and the teacher says, can you sit back down? They'll say, yeah, okay, and they'll sit back down. And maybe 30 seconds later, they might be up again, and they'll say to them again, can you sit back down? They'll go, yeah, yeah, sure. And so they're a little bit less distressed. It's a little bit more kind of, again, they just have that feeling, I need to get up and move, but it's not as much of a kind of soothing element to it. So again, thinking about the quality of the behavior and the nature of it, is it again varied, or is it a bit more that you'd see the same kind of behaviors over and over? And that's something which you can kind of help to discriminate between the two. And then the last aspect I'll talk about in relation to ADHD is in relation to kind of focus. And again, this is kind of looking at interests and about the kind of quality and nature of interests. So again, as you can see from all the different areas, they're quite complex. There's quite a lot of overlap. And so it's something where I'll try and give you a bit of a sense of the similarities and differences here. So with autism, again, you tend to see kids might have more intense or longer term interests. So longer term, over kind of months or years, in specific topics or specific areas. And I kind of say there about engaging in different ways with it. So maybe kind of that's in kind of maybe if a child is spending kind of let's say uh, they're engaging with their interests over the course of an evening. And with autism, you might see the child kind of very focused on the same area or same topic, but they might be kind of engaging with it in slightly different ways. So maybe reading, maybe looking at videos, maybe kind of coming and talking about it, and kind of saying, oh, I wanted to tell you about this thing that I just read, or wanted to tell you something about this topic that I'm really interested in. With ADHD, you can see a person's focus kind of can be a bit more fleeting and can shift a bit rapidly. But if a task is very, very stimulating and really, really there's a very kind of strong uh, kind of buy-in for it, then we have what's called kind of hyper focus, which is where the child is able to kind of sit down and maybe do the same activity for up to hours. Kind of, it can be hours kind of doing the same thing. But this tends to be what we call it touches on a concept called psychological flow, which is where a person is kind of locked into an activity and almost seems to kind of just be so focused on it that they're not really kind of attending to what else is going on. So you're really locked in, you're really focused on it. And this can be kind of with certain interests that the person has. So things like maybe drawing or playing an instrument, and you can just sit and do it for hours. And the person might be highly kind of stimulated by that activity and very kind of drawn into it. But that differs a little bit to what, again, that kind of intense interest might look like with autism. So hopefully that gives you a bit of a sense of the differences kind of in engagement, or what I mean by engagement there. Um, Again, with autism, it can tend to be the case where maybe the person might have a slightly smaller range of interests, and they may kind of prefer to kind of to focus on a smaller range of interests in a greater degree of depth, and might find it hard to get motivation for less preferred activities. With ADHD, you tend to see kids having a fairly typical range of interests, but inattention can make it very tricky to keep focus. So even when the child is motivated, and this can kind of come across with school subjects, for maybe kind of an autistic child might be more keen to say, and again, it varies based on the person. They may be more keen or open and kind of saying, look, I just don't like that subject. I really hate it. I don't have any interest in it. I want to do like I'd be happy spending all my time looking at English, or happy spending all my time looking at maths, but I hate this other subject. Whereas with ADHD, it can be the case where a person is kind of saying, "Look, I know I'm not as interested in the subject, but I'm going to try and engage with it because that's kind of what's expected in school." But it may be challenging, kind of even for kind of keeping that kind of motivation. So the person might be aware of it and really trying to, but again, is struggling because of that inattention and that difficulty with focusing. So they're really motivated too because they're thinking, "Oh, another goal down here in terms of working towards maybe an exam or something like that." But they're really struggling to try and engage just to do with that inattentiveness. And again, in relation to kind of details, so with autism, you may see a child being a bit more focused on details and a bit more attentive to details, and their interests are longer lasting over time. Whereas with ADHD, they may be a little bit more overwhelmed by detail. So that kind of level of detail can be a bit overwhelming. And again, interests might be a little bit more short-lived because of that kind of maybe seeking out novelty, and that being something that is a characteristic. So again, in terms of questions, you're thinking about if they're doing an activity for a long time, what's the kind of nature of that? What's their engagement with it like? Are they spending hours doing it exactly the same way? And are they kind of basically kind of just tuning things out around them and really locked into it? How often does that happen? Is it kind of rare, or is it fairly kind of common? Also around the level of interest the child has, is it a fairly kind of typical level of interest, or is it a fairly in-depth level of interest? And do they have a very kind of specialized level of knowledge, which is more common with autism than it is with ADHD? And again, that kind of frustration, do you notice that kind of frustration where the person's trying to focus on a topic, but they're struggling to kind of find the motivation, or they're struggling to try and keep attending to it? Or is the person saying, look, I actually just don't have an interest in that, or the child's saying, I'm not interested in this and this, but I really love this, and I'm really, really focused on it, and able to kind of to engage as much as I can. So that hopefully gives you a bit of a sense of the overlap and the differences between autism and ADHD, and what kind of things they might be seeing, and the ways they can be similar, but underneath again the reasons for them being different. The next thing we'll talk about, in the final area we'll talk about this evening, is in relation to intellectual disability or global developmental delay. And you may have heard both terms, or you may have heard one or the other. So again, global developmental delay and intellectual disability are neurodevelopmental conditions. So they particularly are related to learning. So, and we're talking about across almost all areas of development. So language, problem solving, everyday skills. And what they mean really, what we mean by talking about intellectual disability or global developmental delay, GDD, is that a child will need much more repetition of a task or a skill to retain their learning with it. So they may need to see something demonstrated, or be told it, or shown it more times than will be typical. So just to clarify a little bit, so GDD, so these are both associated, and sometimes people might think of them as kind of as separate kind of things, but GDD is related to intellectual disability in that it's only used for under fives where the child's profile is unclear, because there's a degree of complexity beyond just learning. So it's the case that intellectual disability, if a child's profile is very, if it's kind of clear that they have kind of global learning needs under the age of five, a child may get a diagnosis of ID under the age of five. But if the picture is a bit more complex and it's hard to kind of tease things out, because as I said at the outset, even for clinicians, it can be tricky to kind of tease things out. And oftentimes, seeing how the child progresses over time is the most helpful way of kind of doing that. So that's where that kind of concept of GDD comes in. And it's often, but not always, the case that an earlier GDD diagnosis will become an ID diagnosis over time following a review. It is the thing in terms of autism and the overlap there. So both autism and ID and GDD can involve delays around developmental milestones and around needs in relation to emotional regulation and dysregulation, impact on social communication, and also adaptive behavior. And by adaptive behavior, what I mean there is everyday skills And I'll talk to you a little bit about that now in a moment. So the other thing is, again, as with everything else we've talked about this evening, so autism and ID and GDD can co-occur. So ID and GDD don't co-occur because, again, one precedes the other in relation to GDD for under fives, but autism and both of them can co-occur. So again, it can be challenging to kind of tease that apart. But when you're looking at it, so you're looking at kind of developmental milestones, and this is probably the most helpful thing that we look at as clinicians, and that for parents as well to kind of look at. And you can see there an example of a number of different developmental milestones that we look at when we're doing an assessment. So what we see kind of if it's not clear, and again, because there can be elements of delay with developmental milestones with autism, usually the thing that characterizes it or that can help to make it a distinction between the two or differentiate between the two would be that kind of idea of a spiky or an uneven profile. So where an autistic child might have a number of areas where they're developing quite typically. So maybe in relation to problem solving, maybe in relation to kind of like feeding or dressing, they might be progressing well with, but there might be some areas where they're delayed. So sometimes it can be, again, in relation to speech and language where there are delays there, or in relation to specific aspects of kind of self-care skills. And that delay can sometimes be because of a lack of interest or motivation in activities. And it can also relate to, so again, maybe a child is not that interested in certain kind of aspects of play. And so they're not practicing it and they're not progressing in that area because they're not that interested in it, or they're not, they have, again, a couple of interests that they really, really love, or a couple of play interests they really like, but they're not interested in that in others. And so they're not progressing with those ones. It can also be in relation to joint attention. So if you're trying to, kind of teach a skill to a child, and it may appear that they're kind of watching or attending, but they may actually be focused on what they're doing themselves. They may not actually be tuning into what you're showing or what you're demonstrating. And so although you feel like it might feel like, oh, I've shown my child this kind of a few times and they don't seem to be getting it, they may not actually be tuning into what you're showing, or kind of tuning in or attending to what you're demonstrating. So that can sometimes look like they're not progressing with it, but it's actually that they're not attending while you're trying to teach them the skill. It can also relate to avoidance. So that can be because of distress, maybe, or anxiety. Again, sometimes that can be to do with developing the skill, but also in relation to maybe kind of sensory experiences. So some kids might be, let's say, again, I've given the example of teeth brushing, and where they may not be kind of progressing with brushing their own teeth, possibly because the sensory experience of using the toothbrush on their teeth is so overwhelming that they have no desire at all to do it. And so they have no desire at all to learn how to do it. So although that can look like they haven't progressed with the skill or they haven't learned the skill, it may be because of, again, more so related to kind of sensory impact, and then maybe kind of distress or anxiety that comes from that sensory impact. The other side of it for autism can be that the person's play might appear to be delayed because they're focusing on specific interests. So maybe a child is more kind of really, really loves sensory play, playing with water, playing with sand, playing with Play-Doh or things like that. And they really just want to do that as much as they can. And so they're not really trying out other different kind of play activities, that they're not as interested in them. That differs a little bit to intellectual disability. So again, as I say, with intellectual disability or global developmental delay, you would expect to see delays across many areas. So around, again, not just limited to a couple of areas, but across kind of more globally. And also you would expect to see that delay despite, again, efforts to kind of teach a specific skill. So giving a lot of effort to kind of teach or support or develop a skill, but and where the child isn't really kind of pushing back or avoiding it, or where there isn't that evidence of kind of the child not attending while you're trying to teach the skill. And it can be the case as well. And again, this is just where that kind of something can look similar while having a different reason for it. So again, some kids who are finding a skill difficult to learn, despite trying, it may be the case that they can become reluctant to do it because they're feeling like this is too challenging, and I'm feeling a bit stressed out doing it because I know that I'm finding it difficult. And that can sometimes look a little bit like where an autistic child might be reluctant to do an activity because of, again, the sensory experience maybe, and they're avoiding it for that reason. So again, that's where maybe kind of support from a clinician kind of in terms of teasing that out and working through the possible reasons for it can be helpful. The other aspect there, as I say, in relation to play, for intellectual disability may be that the person might find that their play repertoire, the kinds of play they do, might be a little bit kind of narrow in range because maybe the complexity of doing kind of more elaborate plays, things like imaginative play or involving problem solving, might be challenging. So that the child may do more kind of functional or sensory play, but maybe because it's challenging to kind of learn imaginative play or learn around more complex kind of problem solving and cause and effect play because because again they may find the that they need to kind of see or have it demonstrated or to have done an activity a greater amount of times than would be typical in order to kind of learn it and integrate it. So again, the main questions here would be having a look at the development across areas or in specific areas. So is your child kind of developing fairly typically in certain areas, but they're more delayed in some specific area, they're delayed in specific areas. That may be more likely to be relating to autism or something other than intellectual disability. How much is your child attending when you're teaching a skill? Do you get a good sense that they're really kind of making a big effort and they're still finding it challenging? And do they require a lot of scaffolding and repetition if they are attending? Because again, that might imply that there's maybe a learning need for the child. And also, again, if something has been kind of flagged by a professional during developmental checkups. So again, in relation to a number of those kind of milestones or adaptive skills. The last area I'll talk about is in relation to social communication and interaction. So again, where you might see differences between autism and intellectual disability here are around that kind of motivation to play. So again, coming back to the very start, talking about that kind of engagement and motivation to engage, where you might see that with autism. Typically, kids who have intellectual disabilities might be they might have that kind of strong social motivation, be very interested in engaging with others and responding to others, but they can find it again a little bit tricky to keep up with the complexity and play with their peers. And that gets a little bit more as social demands go up over time, as I said earlier. And so it can be the case that that becomes a bit more apparent that the child is really keen to engage, but they may find it hard to keep up with complexity. So that's not necessarily because they don't have the kind of they're not tuning into kind of social rules or social understanding, but it might be more so to do with the complexity of the play and complexity around things like language that their peers might be doing. For both autism and intellectual disability, kids may prefer active play with others, with their peers, over imaginative play. But again, the reasoning for that, so it can be both due to complexity for both, but also to do with a lack of interest kind of in doing imaginative play with autism, where the child may be interested in doing it with intellectual disability, but it's just a little bit more challenging. So that's something that can look similar for both. And again, in relation to the kind of aspects of social communication, so typically you may see children with intellectual disabilities using a fairly kind of typical range of verbal and nonverbal strategies. So their use of eye contact may be a little bit more typical, maybe a bit more frequent. Their use of gestures maybe, so they might have maybe a narrower range of gestures, so not using maybe more complex gestures, but they're using kind of gestures fairly frequently, whereas an autistic child may be using gestures a bit more rarely. So you're looking at how frequently are they using a strategy as well as are they using it at all. And again, that can come even where a child with an intellectual disability does have a challenge in relation to spoken language, where they may not use very many words. You would still see them maybe attempting to use other strategies and maybe kind of compensating by using other strategies, where that may be a little bit less so with an autistic child. So their way of communicating will look a little bit different. So again, in terms of kind of what to look out for or what might help tease it out. So have you noticed any delays kind of in the area, and would they be relating to verbal or spoken language, or is it broader than that? It's often common for autistic kids to have delays in relation to their spoken or verbal language. And again, it's kind of looking at is that the kind of limit in terms of the delay, or is it a broader kind of range of delays in that, or is it across a number of different aspects or areas? And also, again, looking at that kind of social motivation. So even if it is challenging, how motivated is the child to engage? And that can help tease it out a little bit as well. So just to kind of summarize and to talk a little bit around the overall kind of thing to take. Again, there's a lot you can probably gauge. There's a lot of complexity in across all these areas. There's a huge amount of complexity, and again, that was a real kind of whistle stop tour and trying to pick out a few areas that are most kind of people ask about a lot or would be most familiar with. But there's a lot more to it even than that. And so again, I think you'll probably have a good sense that people neurodevelopment are complex, and even as clinicians, it's challenging kind of trying to take on board all the information, trying to really build up that picture of a person over time and really understand and tease things out. And again, as I say, I've been mostly focusing this evening on differentiating between, and you get into another layer of complexity when you add co-occurrence into the mix as well. And again, all the things we've talked about can co-occur and overlap. And so, again, hopefully you have a good sense of that. As I say, the same kind of behaviors can have very different underlying reasons for them and can look very, very similar for across kind of for the same child or across different children. And again, it's really trying to individualize it and understand each individual person and their own individual context. And it's also just to kind of reassure the people that it is the case that when you're in the middle of a situation, it's very, very tricky to try and tease things out and try and figure out what exactly is going on and what's happening. And that's not unusual at all. So hopefully you'll find that the questions that I've kind of put there will give you a little bit of a sense of what to tune into, what can be kind of what you can pick up on, but also that it is the most helpful thing is being able to kind of have a bit of support with kind of stepping out of the situation. And that's where kind of clinicians, that's where psychology comes in, kind of where we can kind of maybe get a bit more of an overview or kind of step back from things or support you in stepping back from things and looking at things and considering it from different kind of angles and why you might be seeing certain behaviors, why you might not be seeing certain behaviors, and again trying to tease everything out. And the last point is something that, again, I think I finished our previous talk on, and I think it's just again worth reiterating that again with all of this and in terms of all the things we talked about, again, a diagnosis or a kind of identifying a condition is a lens for understanding a person. So it's not a label to limit. It helps us to understand the person. So thank you so much for your attention. Thank you so much for again joining us this evening. And Paula, do you have anything that you'd like to add or anything to follow up with?
Just as always, Owen, a massive thank you to yourself for your time, your expertise, and your insights. We have ran a little bit over, but any questions, I've dropped our details into the chat. Please do send them through. Our team are here to help. Reach out to us if we can be of support to your family. That's exactly what we're here for. Just again to say thanks to each of you for joining us and for staying with us throughout the evening. Owen, a fabulous session as always. Have a lovely evening, everybody. Take care. Bye bye.
Thanks so much, everyone. Take care.